Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. In Prince George today, Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for today. I'm honored to be here in Vancouver on the territories of the Musqueam, of the Squamish, and the Tsleil-Waututh First Nations. Wednesday, Thursday, and Friday we'll be providing at approximately 3 o'clock written briefings with relevant information about the COVID-19 pandemic in British Columbia. And with that, it's my honor to introduce from Prince George, Dr. Bonnie Henry.
Thank you very much. This beautiful day today. As of today, here in British Columbia, 77.7% of all adults have been immunized against COVID-19, and 76.2% of everyone 12 and older have now received their first vaccine dose. We've delivered 4,511,923 doses of all three COVID-19 vaccines in British Columbia, and of those, 1,192 are second doses. So we've now have over a million people in British Columbia who are fully vaccinated and protected against COVID-19. We have seen some fluctuations, as you know, in supply over the last number of months, which means that some days our mass clinics will have more of one of the mRNA vaccines than the other. Currently, it is Moderna that we have quite a lot of right now and will have in the next few weeks. And we've received word that there may be some decrease in the Pfizer shipments that we're receiving, particularly in the coming weeks. We will do our best to make sure that we have both products available at our clinics, but sometimes that simply isn't possible. And with the millions of doses of vaccines that have been delivered here in Canada and across the world, we are confident that both of these mRNA vaccines are safe and effective and can be used interchangeably. If you are offered the other mRNA vaccine, please be assured that it is safe and it is effective to have either one of these products here in Canada and here in BC. They are both highly effective and very safe. Really, these are the same vaccines. It's the same piece of RNA, the messenger RNA that stimulates your immune system. It's just packaged slightly differently in a slightly different package. And we are confident in the safety and the efficacy of them being used interchangeably. So today, in terms of our cases of COVID-19, we had 56 new cases across British Columbia, bringing the total number of people with COVID-19 in BC to 147,187 people. Of the new cases, 12 are people who live in the Vancouver Coastal Health Authority, 18 are people in the Fraser Health Authority, 3 are people in Vancouver Island, 15 people live in the Interior Health Authority, 7 here in Northern Health, and 1 is a person who generally resides outside of Canada. We currently have 1,150 active cases, 111 people are in hospital, 41 of whom are in critical care or ICU, and 143,579 people have recovered from their acute illness with COVID-19. We have no new deaths to report today, so that leaves a total of 1,743 people we've lost to COVID-19, and our condolences and thoughts are with the families and the communities who have lost their loved ones. The outbreak here at Heritage Manor in Northern Health is now over, and that leaves us with 2 active outbreaks in long-term care and assisted living and 1 in acute care in the province. It is really wonderful to be here in Prince George with my colleagues from the Northern Health region, and this week I'm taking some time to meet with our teams, the teams that have been on the ground, both here in the north, and later in the week I'll have the privilege of going to meet with our teams in Interior Health. And I know how wonderful it is, having been so many months, that we've been working together, pulling together, but mostly remotely. British Columbia, I don't have to say, is a diverse province. And we know that while we have all been in the same COVID storm, the experiences in each region have been very different. In smaller, more rural communities, the risks may be smaller with fewer people coming and going, but we also know that communities across the north are very connected. And as we have seen, If the unwelcome guest of COVID-19 enters a community, it can have a tremendous and sometimes devastating impact. Over the past months, when that happened, we know that great work has been done by Northern Health, by everyone, to respond, to try and protect those most at risk, particularly our seniors and elders in communities, in First Nations communities, to support isolation and care of people, in the ICUs and the hospitals who provided that extra care for those who needed it, and of course the essential work of the transfer teams when it was necessary to move people south for care. And we know how hard that was on families and communities when that needed to happen, and it was something that happened across the north over these last few months. And I just want to say my thanks and my gratitude to all of the teams that have been working so hard and the communities who've made it through this really challenging year. But this is also why, for many communities across the north, we have taken a whole-of-community approach to immunization. We know that it's by protecting all of us, we protect our communities and our families, to ensure that no community and no person is left behind. And to have the summer that we want, to maintain those connections that we have across communities in the north, whether we're receiving visitors from elsewhere, other communities, other provinces, or whether we're traveling for work, we're traveling within BC, or eventually whether we are able to travel internationally again. Vaccination is our key to being able to do that safely and to keep our home communities safe too. We were talking in Northern Health today, and I know there's been many different strategies that have been used to help bring vaccine to people and communities across the north. But if you know of a place or an event or a gathering where a pop-up clinic or a mobile clinic would work in your community, let Northern Health know. And you can let them know by sending an email to covid-19@northernhealth.ca. So we can bring vaccine to those who need it and who haven't had a chance yet. And I would encourage all of you to encourage your friends, your family, your neighbors. Have a conversation with your primary care providers. Make sure that you have the information that you need. There's lots of credible information on the BC CDC website about the safety and the efficacy, how well these vaccines are working. And we see that in communities around us. When we're immunized, we protect each other and we protect ourselves, and that's our ticket to travel and to getting into a better summer for all of us. As we move through Step 2 of the BC Restart Plan, we are progressing well. We continue to see a sustained drop in hospitalizations, in new cases, in clusters and communities across the province, and now over 1 million people are fully immunized. This gives us a strong foundation for our summer ahead, a summer of hope and a summer of healing, where COVID-19 will be in the background instead of front and center in our lives. Our progress on dose 1 immunizations is steady, and those dose 2s are rapidly increasing. But the virus is still with us, and we have seen in other communities around the world, in the UK, in Israel, in our neighboring territory in the Yukon, where it can still cause disease and illness and spread, and some people can get seriously ill. Vaccines are our best protection, and there is still potential of this virus to affect our communities. So to make this a summer we can all enjoy, I encourage everybody, make sure your children are immunized before the summer holidays get underway. Encourage and keep your family members near and far to do the same. And book your second appointment as soon as you are eligible. Our progress through this pandemic is the result of everyone working together, and we have done that in BC. Doing our part, supporting others to do theirs. I've said many times we're all in this same global storm, but we are not all in the same boat, and people in the north know this well. But we have done the right things, and we need to continue to do that, to make that extra push, to make sure that we're as best protected as we can, supporting each other to be immunized as we bridge to these brighter days of summer. Let's get our vaccines. Remember to continue to use our layers of protection as we have for the last number of months. And of course, let's always remember to be kind and to be calm and to stay safe.
Thank you very much, Dr. Henry. And I think I want to start today by acknowledging that it's the best kind of day for us in doing these reportings, a day where we are reporting 0 deaths related to COVID-19 in British Columbia. But that leaves us, of course, with the 1,743 people who have passed away from COVID-19, and we think of them today. And obviously all those struggling with our other public health emergency, the overdose public health emergency, which continues as with COVID-19, but in its very significant way, affect people and communities in every part of the province, including, as Dr. Henry knows, in the north, but everywhere else in BC. Obviously, today also we see a continuing decline in the rolling test positivity. The 7-day average is now 2.06% province-wide. It's 2.09%, essentially the same in Fraser Health, which shows the progress we are making both with immunization and with control of transmission in Fraser Health, which is significant. Also, I would say, though, we're seeing and we continue to see what I would expect to see in the coming months, which is our healthcare workers who have devoted themselves in this period of anxiety and suffering from COVID-19 to an extraordinary extent everywhere in the province. Those healthcare workers are dealing with real challenges in our province right now. Those challenges include the 1,765 ambulance calls that they went out on yesterday, significantly above the pre-pandemic average of 1,540, and the 7,187 emergency room visits yesterday. So our healthcare professionals and healthcare workers continue to do remarkable work around the province, to face real challenges, and deserve and must have our support in every possible way. I wanted to acknowledge the success of the immunization program, the success by pharmacists in our province, the success obviously in our immunization program, IMSS-BC program across BC. Just to note that over 70 today, 89% of people have received their first dose of vaccination, 55% their second dose as well. Over 60, it's 87% first dose, 41% second dose. Over 40, 82% first dose, 29% second dose. Over 30, 80% first dose and 20% second dose. And overall, in the plus 12 population, 76% first dose and 21% second dose. All of these things, I think, reflect the efforts around BC, and this has been, as we said, the largest immunization program in BC history, and it truly is remarkable. As you'll know, because this information is available on through the BC CDC every day, we have had some shift in our supply of Pfizer, and reported on that last week of the Pfizer-BioNTech vaccine. This week we haven't received. We're expecting, and it's unchanged, to receive 327,600 doses of Pfizer, but it has not arrived yet. And so Pfizer on hand is actually, at the end of the day yesterday, was about 40,000. And this is the adjustment that Dr. Henry was referring to. Clearly, the federal government is having a significant and bringing in a significant supply of Moderna, and we've seen this in the numbers, which is dramatic, and that these vaccines, these mRNA vaccines, are interchangeable, and that if you're like me and receive Moderna as your first dose, you're more likely to receive, of course, Moderna as your second dose. But many, many people who receive Pfizer as their first dose are going to receive Moderna as their second dose. And clearly, in terms of its procurement strategy, the federal government will have, as they did in March and April and May, when they had a lot of Pfizer and it became our workhorse vaccine, and less Moderna. To a degree, the reverse is happening now. And the key is to follow the direction, the guidance of public health, and the message that Dr. Henry delivered earlier is the important message for everyone concerned. I want to just say finally, I think, that a bunch of months ago I was right here in this spot and said, Dr. Henry was here, and I talked about it not being too late to join the fight, and really everybody did in important ways. In our BC response to 3 waves of COVID, we stayed with it, we recommitted to it when spirits fell, and by finding new reserves of compassion and purpose and strength and resolve when our participation was urgently needed and asked for, all of us found more to give, no less than our healthcare workers and communities, but our communities throughout the province did the same thing. And they produced a difference that is reflected today, I would argue, in the declining case numbers we see and in our progress through steps of our restart plan. Our BC experience shows that it's never too late to join the fight, never too late to get your first dose of vaccine, and I encourage everybody, every single person, to get registered and to get vaccinated. With that, everything is possible, everything. The events of the past months and the past few weeks especially have, I believe, offered us a new vision of ourselves and of our future together. And for this, I have two hopes: that each of us is able to see, experience, and build on this new awareness and appreciation for one another, and that each one of us can share in its promise. Aujourd'hui, nous annonçons 56 nouveaux cas qui ont testé positifs pour COVID-19, 56 quand même, pour un total de 147 187 cas en Colombie-Britannique. Il n'y a eu aucun nouveau décès lié au COVID-19 pour un total de 1743 décès en Colombie-Britannique. Nous offrons nos condoléances, bien entendu, à tous ceux qui ont perdu leurs proches durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 111 personnes, 111 personnes sont actuellement hospitalisées, dont 41 en soins intensifs. Merci beaucoup. Thank you very much. We're happy from Prince George and Vancouver to take your questions.
Thank you, Minister. A reminder to reporters on the phone that you may now press *1 to enter the queue. You will be limited to one question and one follow-up today. Please also remember to take your phone off mute, as you will not be audible until your name is called. Our first question today comes from Lisa Cordasco, Vancouver Sun. Lisa, please go ahead.
Thank you. Dr. Henry, can you talk about the areas of the province that have seen the lowest vaccination rates and, the reasons why, and whether that's one reason for your traveling around the province?
Sure, and I'll talk, and I know the minister has some interest in that as well. There are a number of different areas, and what we have seen is that when we pay attention to different areas and when we use different strategies, they work. And we're not seeing widespread anti-vaccine sentiment. What we are seeing are some areas where people have questions, some areas where there may not be as equal access. And that's why we put out the word today about people who have ideas here in the north for their community where we could go and set up a clinic. And those have worked really well, some of the drive-through clinics in some of the areas. And we know in the northeast, there's a number of smaller communities spread out in rural areas where it's more challenging for people to get into an immunization clinic. And we've had challenges with teams and staffing and being able to get everywhere in the north. So these are one of the reasons I'm here. But the other reasons I'm here, of course, is that it's been a long time and I haven't had the opportunity to meet with our teams and to really just appreciate all that they've been doing across the north and the interior, and just grateful for that opportunity. So it varies by different communities, and I know on the ground here they're looking at that very carefully. What is it about each individual community and what are the things that we need to do in each individual community? But the other thing I think that's really, really important, and I appeal to my colleagues in primary care across the province, having those conversations with your patients, with your family, with your communities. It is important that we all give people the information they need, and hearing it from a trusted provider is important too.
Just to say to thank many of the communities. We saw in Grand Forks this weekend. We see in 100 Mile House today. We see in Richmond, which we were getting questions on, and we were looking at as we provide this information, as people look at the same information we do, was significantly below the provincial average. Now the Richmond local health area is above the provincial average in terms of over 12 first dose immunization, which is a real achievement of community. So our approach from the beginning has been to work with communities and work with people, not to draw conclusions, but to see slightly lower vaccination rates in one community as a challenge for all of us to raise those levels up, because when we immunize people, whether it's drive-through clinics in Fort St. John or in a park in Grand Forks or a 24-hour or 36-hour vaxathon in Surrey, we find different ways to reach people and to raise those levels of immunization. I'm very proud, for example, as of today, I think in the Surrey local health area over 12, we're going to have over 80% immunization, and that's an achievement not just of public health and of public health workers, but of the whole community there, of unions and business groups, of Gurdwara and mosque and church organizations, of everyone. And we have to continue to do the same effort. Everyone is everywhere. So it's not to point out those who are falling behind, but to help us raise those levels everywhere. And the community that was behind a few weeks ago, we hope will be ahead in the coming weeks, and that will require more hard work.
Lisa, do you have a follow-up?
Yes, thank you. When do you expect or hope to have 75% of British Columbia's population fully vaccinated with 2 doses? And would it be reasonable to expect that could happen by July the 31st?
The short answer is yes. Obviously, we want to do that as fast as we can, but we also want to make sure that we keep that a good interval between dose 1 and dose 2. So there may be some spillover in people who are just getting immunized now into early August, but I think we can get up there. And we're looking at certainly middle of July to try and get to 80% across the board. And then looking at how do we get second doses into people as quickly as possible as well.
Our next question is from Richard Zussman, Global. Richard, please go ahead.
For both Dr. Henry and Minister Dix, I'm trying to get an understanding of where we're at with AstraZeneca. I understand there's been a substantial drop-off in the number of people who have received the vaccine since the NACI guidance was put out. Can you give us a sense of how much that drop-off was, and whether the federal government has offered BC additional AstraZeneca, and whether BC has accepted that offer of additional doses of that vaccine?
Yeah, so I can tell you that there's a combination of things. And yes, we did see some drop-off, but it's unclear for us exactly how much, because there's a bit of a lag when in pharmacies entering data into the system. And there was a bit of a glitch on that on the weekend. So we did see it drop off quite considerably, but it's picked up again yesterday and today. So we think it's partly a data thing and partly people making that decision. Before last week, we were about 50-50, where people were making the decision to have a second dose of AstraZeneca or to opt for a Pfizer or Moderna dose. And part of that was because our second dose clinics, our mass clinics, were still being very well subscribed by people who were in the age-based program. So it was easier for many people to get their AstraZeneca dose. And really, people who committed to getting AstraZeneca, when they did, many people committed to getting 2 doses of the same vaccine, and I think that is a perfectly valid decision to make, and certainly a recommendation that I have made to some of my family members, and it is a very good and safe and effective vaccine, and we know that from the millions of people around the world that have received it. But Minister, did you want to talk about some of the data? Yeah.
Just briefly on AstraZeneca, because our data over the weekend, the data that was posted yesterday, didn't reflect all of the doses of AstraZeneca that been received. There has been a drop-off since the NACI recommendations of Thursday. In the days leading into that, we were doing about 6,000 doses of AstraZeneca a day. Over the weekend, so these two numbers add up, 1,204 plus 13,350 over 4 days. So that's roughly 14,000, well, it is 14,454 doses over 4 days. So you see a decline. Absolutely, and the AstraZeneca against what we were doing before. Not as steep a decline as our dashboard showed yesterday, and as people rightly reported, and the reporting was absolutely accurate, the dashboard hadn't picked up all of those. So what we've seen is a decline in AstraZeneca from between around 6,000 a day to in the 4,000, just under 4,000 a day range over the last since the NACI announcement, and that it continues to be available, as Dr. Henry says, in pharmacies around around BC, and I know many people are choosing the option to have a second dose of AstraZeneca after having received their first dose of AstraZeneca. So a decline, yes. In terms of the amount of AstraZeneca, we are and will be receiving 10,000 additional doses this week, which is a relatively small amount, but will help and helps us continue to sustain that program into the future. Our expectation this week overall in terms of doses, 10,000 AstraZeneca, 896,000 Moderna. How about that? And it hasn't arrived yet, but 327,000 doses of Pfizer. So we're going to have vaccine, and the key is for everyone to get registered and get vaccinated.
Richard, do you have a follow-up?
I didn't hear an answer there on whether the province has turned down any doses of AstraZeneca from the feds, but I'll leave that there. I also need to ask about schools. There's a study out done by UBC.
The answer to the first question is no.
Okay, thank you. And so on schools, I'm sure you've seen the study that's come out from UBC along with Coastal and Children's Hospital showing very minimal spread of the virus in a school setting. What does this survey mean in terms of what the province is planning on doing come school in September? And also on the issue of kids and vaccine, the World Health Organization clearly on its website says the COVID-19 vaccines are safe for most people 18 years and older, and children should not be vaccinated for the moment. How do you square the World Health Organization guidance for what BC is doing?
Okay, so a couple of things. One, I'll just go back to the AstraZeneca to tell you that no, we have not turned down doses, and it is available for people who don't want an mRNA vaccine, and there are some people who don't or who can't, who have an allergy or some other reason why they can't take a Pfizer Moderna vaccine. So that is still available through pharmacies, and we can assist people in getting it if they need it. So yeah, that study was one that was done independently by UBC, but is not surprising to us, and it really confirms what we were seeing on the ground, that we're not seeing a lot of transmission in the school settings. And so that is reassuring. It's reassuring to all of us that the measures in place were working and that that type of a structured environment is a safe environment. And I think we can be very proud, and all of the educators and our school staff should be very proud of being able to keep schools functioning and safe for staff, but also so much importantly for families and for children across the province. And I think that's a major accomplishment that people have done here in BC. And this study is one that looks at seroprevalence, so it looks at whether there was infection, whether people noticed it or not, and it shows that that was very low and reflected the rates of infection in the community. So that is reassuring to all of us that the things that were in place were worked. In terms of the WHO recommendations, there's been a lot of discussion at the WHO about prioritization for immunization, and their statement reflects the fact that they have very clearly said that as a global community we should be immunizing healthcare workers and people most at risk in communities around the world before we turn our attention to immunizing those who are less at risk. And that is an important role that the WHO plays in providing recommendations globally. What I can tell you is we know that there has been studies done looking at safety and efficacy in children down to age 12, and there are additional studies being done in children down to 6 months of age, and Health Canada has approved these vaccines as safe and effective in those age groups, and they are an important age group for us in terms of protecting our communities, and that's the decisions we've made in Canada and in many other countries. And I think we only need look at what's happening in the UK and in some other countries where they have not prioritized immunizing, especially teenagers, where we know that transmission can happen. And that is a group of our population age group that is very highly connected. So we can get a lot of transmission very quickly in young people. And that's why immunization is so important to protect communities, because once you get transmission in young people, you can get spillover into older people, into people who are more likely to have severe illness and end up in hospital. And we see that even in highly protected communities.
Question today comes from Binder Sajan, CTV. Binder, please go ahead.
Hi there. I'm just wondering, with regards to AstraZeneca, if there's a bunch left over, is there any way that you would possibly give that as a second dose to people who had mRNA vaccines? And also, I know we've seen in some places that people who got Pfizer aren't happy with getting Moderna. Are we seeing any refusals here in BC?
You know what? I think there's a little bit of brand shopping in that people who get Moderna are on Team Moderna and people who get Pfizer are on Team Pfizer. And same with AstraZeneca. Really what we need to focus on right now is that the mRNA vaccines really are, I think it was described in one of the articles I read as, different water bottled by different companies. They are the same, very much the same antigen, the part that stimulates your immune system. They're wrapped in a different lipid nanoparticle, but other than that, they are interchangeable. And we've seen with millions of people now that it's safe and effective to do that. So I don't see a scenario where we would give AstraZeneca as a second dose, with the one exception of people who have had an allergic reaction to an mRNA vaccine, and then AstraZeneca or a viral vector vaccine, or there are a number of other vaccines in the pipeline, would be a viable option as a second dose.
Or do you have a follow-up?
I do. Minister Dix, this question is for you, for one of my colleagues. Sources are telling us that cardiac services in the Lower Mainland are, quote, a disaster. And they say they're seeing severe staffing shortages. They're barely able to staff the cath lab, and a fraction of open heart surgeries taking place due to a lack of ECMO machines and people to run them. So can you tell us where on the priority list are cardiac services and when they will be back to pre-pandemic levels?
Well, cardiac surgery, if you talk about ECMO machines, we've gone, in time I've been Minister of Health, we've doubled the number of ECMO machines, and we're significantly increasing our training of perfusionists across the province because we see this as a challenge into the long term. There were some scheduling changes, delays in heart surgeries, as there were other things over the months of April and May. Those surgeries have rapidly been rescheduled. I think the overwhelming majority of them in Vancouver Coastal Health that had been deferred have already been done, for example. And so I think we're continuing to make progress. But what I said to you before is I think the case that the healthcare system is going full bore on everything else other than COVID-19. And of course, we're also facing another public health emergency as well. So there are, of course, significant challenges. Prior to COVID-19, our hospitals were running at 103.5%. And during COVID-19, they tended to run, in terms of their base bed capacity, about 92%. But I think on the cardiac surgery side, I think people are doing an excellent job, but there's always challenges in our healthcare system in meeting demand. But I think I have a lot of confidence in our staff that they're going to continue to do so. And I don't believe the issue is access to ECMO machines. And as you know, they were being used with respect to COVID-19 patients. That was a useful method of treatment for many COVID-19 patients, or for some who were in ICU. But obviously, the number of ICU patients with COVID-19 is in decline. So, we haven't seen a loss of cardiac surgery. Those surgeries, those that were delayed or changed, are being redone. But that's not to say there aren't significant challenges in the system. I think when I talked to you about the number of ambulance calls yesterday, the number of emergency room visits, there's significant challenges in the healthcare system, and one that we have to give a lot of support to our healthcare workers who have been through this pandemic now for all these many months. Now really, for us, 18 months of dealing with COVID-19. And now, of course, and throughout that period, dealing with all the other issues in healthcare, is doing more surgeries in the past 12 months than had been done before, and all the other things that are happening. So we have to continue to provide support for our healthcare workers.
Our next question comes from Lisa Yuzda, News 1130. Lisa, please go ahead.
Hi there. Looking at the number of doses we're getting, first doses into people, if we stop at 80%, we've seen other countries sort of get to a critical mass, and then they just start adding second doses. And people are looking at, and Dr. Henry, you referenced it, what's happening in Israel and the UK, where they're seeing outbreaks of this Delta variant in unvaccinated population primarily. Like, what is the risk in to BC in particular if we stop at like 80%, or with the approach we're taking of seeing those kinds of outbreaks spreading in our province? You know, is 80% enough if that's what we get to?
Yeah, so I think we need to look at it in a couple of ways. And I spent some time on the weekend with my colleagues in the Yukon who are dealing with an outbreak right now, mostly in unvaccinated young people. But what we're seeing is it's spreading differently, and the UK is seeing that as well. So the more and more people that we have protected, the less need we have to take some of those broad societal measures that we needed to take even a few months ago, because this virus could spread so quickly to so many people. It doesn't mean that every community is able to stop an outbreak as rapidly as we need to. So that's why we're not going to stop at 80%. We're going to be changing our tactics to try and make sure we can, as Dr. Ballum likes to say, continue the ground game and find people and make sure that they have the opportunities to be immunized everywhere. Because it is pockets that we're going to see spread. And unfortunately, even if most people are immunized, we do get some breakthrough. And we've talked about this a little bit. You know, your risk goes down quite dramatically. I know I was asked earlier for some information, some data on breakthrough. And what I can tell you is up to the end of May, the rates of disease we were seeing in people who are unvaccinated was about 86 per 100,000 people. After dose 1, that went down to about 29 per 100,000, and a week after dose 2 is a 15 per 100,000. So really an 80% decrease in risk after having your 2 doses of vaccine. But it's not zero, and we have seen about 2,000, I think it was 2,620 cases after dose 1 where people became infected, and we had 268 people hospitalized and 65 deaths. So while the risk goes down dramatically, it's not zero. And the vast majority of the people who were hospitalized or who died were over age 80. So that still tells us that not everybody mounts as strong an immune response, and we still have to continue to do everything to protect them. And that means younger people being immunized as well. So not stopping at 80 is really important. And in certain communities, it's going to be really important that we get as many people as possible. We know we can't, at the moment, immunize younger children. It's a smaller proportion of our population, and we know they don't get as sick and they don't transmit as much. So we can manage if we have a smaller proportion of people who aren't immunized overall. And then the one other thing I'll say is it goes back to, I've said many, many times that I'm not in this alone, and we have a strong public health team, and we are managing every single case again and making sure that we can stop transmission. And we see that working. We see that working in Fraser Health, where we had outbreaks with the Delta variant, but we've managed to stop transmission, even with people who are infected with some of these variants. So it is important. We're in a pretty critical time between now and the next to the end of July, when we are getting more and more people fully protected, and we need to keep going on those first doses too.
Do you have a follow-up?
I'm wondering if you can give some advice on what to say to people. I had a conversation with someone the other day out at a park, and I said, dealing with people not getting their first doses, and I'm wondering, how you deal, what you would suggest the conversation be to people in your life who are like, I don't need a first dose, it only protects me, for either people who are hesitant because they're scared of the technology or they just don't think they need it, and also for people who are scared that not enough is being done with the Delta variant. So I'm just wondering if you could offer some suggestions that we can have with conversations with people in our lives.
So I think it's really important to try and understand why people have concerns. And as you say, it could be they're afraid of the technology. It could be that they've heard of somebody having a bad reaction. They could be they're worried because they've had a reaction to a vaccine in the past. And so really it is about talking about why I got immunized, what was important to me, the things about my experience, and recognizing that, the vast majority of adults in BC have taken this plunge. And there's lots of good information that people can find. I know there's a lot of misinformation and disinformation, so intentionally negative and wrong information that's spread, particularly on social media. And it's an opportunity to point people in the direction of where there's good, credible information. And I would say as well, the BC CDC website has a really good section on, how do you tell if it's good information and where does it come from and how to talk to people. And the other thing, and I mentioned this a little bit earlier about, talking to your healthcare provider. And physicians are learning a lot about physicians and nurses and nurse practitioners, and we're learning a lot about these vaccines and how they work. And millions of people around the world have successfully and safely been immunized. And I think that's really, really important. And, that's why I got my vaccine early on, because I had faith that these vaccines have been well researched, that we knew they were safe, and that it really showed us, as we've been watching over these last few months, how well they work, even in people who are older, even in people who have compromised immune systems. So I really think we need to take that approach of trying to understand what people's issues are and questions are, and not being adversarial, not starting an argument, because you can never win those things. People aren't going to change their mind just because you tell them that you need to. What you need to do is just open that window of where can you go to get the information that you need, and to be confident in the decision you made to be immunized and to be protected.
Our next question comes from Rob Brown, Dawson Creek Mirror. Rob, please go ahead.
Good afternoon. Thanks for taking my call. My question was, I guess, for either one, the doctor or the minister, but as the provincial approach approaches that 70-75%, there's some other areas that are less, more at about, say, 45-50%. And my question is there any consideration or plan of attack as far as beyond what's been discussed today, beyond, different restrictions or different limitations for the pockets, as you say, of the area of the province that are still at around that 50%?
I think we tend to take the carrot versus stick approach, and that has worked very well for us here in British Columbia. So it really is about encouragement, about answering people's questions, making sure they have confidence in the vaccines that we have. And what we see over and over again is access, taking away those barriers for access to vaccines, making it convenient for people, and that it goes a long way in many, many communities. So we are going to continue that. We're going to be encouraging people, and I think there's this is where community leaders, and I know the minister can talk to this, where your sports teams and all of these activities that we can get back to, because immunization has changed the game for us. It will no longer be a pandemic. It's part of us being able to live with this virus and not have it affect our lives the way it has so much. So things like being able to travel, to come to visit my teams here in Prince George, or our teams here in Prince George, to be able to visit family that we haven't seen. To do that safely, we need to protect each other, protect ourselves, and protect them, and that means being immunized.
Just to say, in your territory, we're now over 50% in Dawson Creek. We were below that before. We're above 50% in Fort St. John, about 54%, I think, in Fort St. John. A community such as Tumbler Ridge, which was down around 51%, is now at 60%. So I think we're making some progress. And you've seen this in some communities around BC, as I said, which were lower and have now seeing significant increases. So what you're going to see is the strategy we've used up to now, which is giving people the information about some of the best vaccines the world has ever seen, to talk about their effectiveness. A community like Prince Rupert has differences in a community like Fort St. John and the other side of the Great Northern Health Authority. But what happened in Prince Rupert was we went from a lot of cases to almost none because people got vaccinated. And people who live in the Northeast, we've seen this in terms of transmission. We see it now in our current maps, are just as vulnerable right next door to Alberta as anywhere else. And so we need people in that region to get vaccinated. We just got to keep working on it together. And I know that Mayor Bumstead in Dawson Creek is supportive of that effort. The local MLAs, Dan Davies and Mike Bernier, have joined in that effort. Mayor Ackerman in Fort St. John and all the other people in those municipalities. We just got to keep working through, not pointing and saying what's wrong, but working to raise those levels of vaccination, which are going to keep everyone safer and allow everyone to get back to all the things they love to do in that great part of the world and great part of our province in this summer and beyond.
Rob, do you have a follow-up?
Certainly, just these pop-ups that you've brought up and broached today, is that something that either the minister or Dr. Henry could see working and potentially upping that percentage up here in the north in general?
This was a discussion I had with colleagues in Northern Health earlier today, and they were saying, people had some really good ideas about where a pop-up clinic would work in their community. So I encourage you all, if you have an idea, I know going to the Saturday farmers market was and having a pop-up clinic there, making it easy for people to go and get your fresh fruit and vegetables from your local farm and get your vaccine at the same time. So it is ideas like that about things that can happen in your community, as we move into being able to come together more often, are these opportunities where we can also come together as a community and be protected. So Northern Health is looking at ways that they can support that. So if you have ideas, as I said, it's COVID-19 at northernhealth.ca, and they're willing to work with you to see whether we can put a pop-up clinic in your community.
Thank you. We have time for one more question. For everyone listening, Dr. Henry and Minister Dix have released a statement with the latest information on vaccinations, cases, and hospitalizations, which you can find at news.gov.bc.ca. For the last question, we go to Tanya Fletcher from CBC. Tanya, please go ahead.
Yeah, Dr. Henry, given the fluctuating supplies of Pfizer versus Moderna, do you have a ballpark percentage of people in BC that will be getting a different mRNA for their second dose than their first? I'm wondering if there's kind of a ratio there that you're expecting. And is the supply of Moderna making up for the lack of supply of Pfizer? Basically wondering overall what this will mean for our timeline overall, if it would maybe accelerate it or perhaps back it up a little bit.
Yeah, I actually don't have a good idea of percentage of people who are getting an alternate mRNA for their second dose. It has varied a little bit by clinic and by area of the province, and it mostly was people with earlier on Moderna not being available because we had challenges with shipments of Moderna. As you know, we've received a whole bunch of Moderna just in this past week, and we're expecting to receive more before the end of June and into early July, at the same time that we've just heard there's a delay and some challenges with Pfizer. So overall, we are getting a net increase in vaccines in June. So yes, it can and will make sure that we can move up our timelines, but we also want to balance, because we know that a slightly longer interval is a good thing. So we can move up a little bit, but somewhere around that 8 weeks is probably still a good thing, maybe as low as 6 weeks. So that will take us into the end of July or early August. But it absolutely is a net increase in the amount of vaccine that we're receiving. And so, yeah, we can get everybody, every adult or everybody over age 12, at least with their first dose by the middle of July or end of July now.
Yes, please. And if we could get an answer from my colleagues from Minister Dix in French as well. Thank you. We know BC is in a much better place these days, but what do you expect to see in the next few weeks? What are you watching most closely at this point to make sure our positive trajectory continues, I guess, vaccination aside? And given the Delta variant isn't spreading rampantly here right now, is it still the biggest threat to our success?
Yeah, you know, I think there's a couple of things that are threats that I'm watching really carefully. And as you know, next week's a big week for us as we're watching the data as we get closer to July 1st. And we'll have more to say about that next week. But absolutely, we're watching, as you know, we're doing whole genome sequencing on all of our cases. When you have smaller numbers, that makes it even easier. We're also watching very carefully what strains are circulating. And I've said this before, you know, it's not like they're an alien, that virus that in space that we can shoot down. It's about the virus that's being transmitted between people. So the actions that we are taking to prevent transmission, and that means the basic public health work that our EHOs and our medical health officers and our public health nurses and our contact tracers have been doing from the very beginning, becomes more and more important. And we're going to continue to pay attention to that, making sure we identify people, that we've got testing, rapid testing available for people with the PCR tests, and being able to stop those chains of transmission as quickly as we can, because that's really important as we're still in this transition phase. And we've seen it can take off with the non-vaccinated community quite quickly. And that's the challenge with the variants like the Delta variant, in that it's more transmissible. So yes, we are watching that really carefully. And, you know, that's where we're seeing some glimmers of hope too, that the teams across the province, as tired as they are doing an amazing job at finding people, supporting people. And, you know, I talked about this with my colleagues, 150,000 people in British Columbia, and public health has talked to every single one of those people who've been sick with COVID-19, and making sure that we can manage this. And we know a lot about how this virus is transmitted and the things that we need to do. So those are the things that we're continuing to follow, as well as immunization, of course.